Hi, this is Brian Kim. I'm going to share with you case number 66 and the best way to do cataract surgery series. This is a moderately dense lens, and the patient has a posterior capsule plaque, and you're going to see double chop, cross chop, mechanical fracturing, and systematic lens disassembly of this lens. So the recording of this case happened a little bit late, so now the viscoelastic has been injected, and I'm using the cannula to hold the eye for the bibeveled corneal incision. I make an incision near the limbus, tunnel through the cornea, holding the eye with the cannula, turning the eye toward me and entering when I reach that little mark on the blade. I'm injecting some more viscoelastic to fill the chamber before I do my rhexis. This is a puncture style capsulorhexis. I puncture the central capsule, pull down, grab the right side of the tear, and then go around to make a flap, and going around circumferentially, trying to use the previous corneal marks I made, which will hopefully allow me to achieve a well-centered rhexis. Once the rhexis is complete, I burp some viscoelastic out, and this is a capsulorhexis hydrodissection technique. I place the cannula out underneath the rhexis edge contra-incisionally, point the tip down, you get a nice fluid wave, decompress, and then I turn the cannula tip on the right side and start to rotate the lens clockwise. Irrigating the surface of the eye, lift the incision, go in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, place the chopper underneath the epinuclear ridge out to the equator, turn the phaco tip vertically sub-incisionally, bring both instruments together and crush the lens in half. That's the double chop. Place the chopper around the right heminucleus, pulling it centrally, dividing that right heminucleus. That's the cross chop. Using a little bit of vacuum to hold that first quadrant, and then bringing the chopper around it, crushing it centrally towards the phaco tip, and then start to emulsify that first quadrant. Using mechanical fracturing forces to crush the lens into smaller pieces before emulsifying the lens pieces. I'm turning the lens a little bit, separating that second quadrant from the rest of the lens, using a little bit of vacuum to hold and pull the lens piece up, placing the chopper around it, crushing it into smaller size pieces, using successive crushing forces to make the pieces smaller, and then emulsifying the lens pieces. Turning the second heminucleus in front of me, placing the chopper around the lens, pulling it centrally towards the phaco tip, which is deep in the bag, dividing the lens into third and fourth quadrants, placing the chopper around the third quadrant, pulling it centrally towards the phaco tip, and dividing that third quadrant in half now, using a little bit of vacuum now to grasp one of the fragments of the third quadrant, lifting it up, and then placing the chopper around it, crushing the lens piece, and then just using successive mechanical fracturing techniques, using the vacuum to hold the lens piece, and then placing the chopper around the lens piece, crushing it into smaller pieces, and then emulsifying the lens pieces. This is the fourth quadrant, placing the chopper around the lens piece. The lens piece is turning a little bit, so I had to place the chopper again, making sure I'm around the lens piece well. Because the lens is actually rotating and tilting, I wasn't able to get actually a full chop, and that was because I was trying to grasp the lens around the endonucleus and sparing the epinucleus, but it kept sliding. And so I had to go around the entire lens, including around the epinucleus, and then I was able to successfully chop that lens piece. Using mechanical fracturing forces to crush the lens pieces into smaller pieces, you can see this is a fairly dense endonucleus, and I'm just sandwiching it into smaller pieces and then emulsifying the lens pieces. Using a little bit of vacuum to grasp that final piece of the endonucleus, lifting it away from the epinucleus and then emulsifying it completely. Now I'm going after the epinucleus, making sure the chopper is deep to protect the posterior capsule. Still have a little bit of lens material that's inside the bag. I'm using the chopper to manipulate that lens piece up. For some reason it was stuck in the bag there. So using the chopper to lift it up a little bit, and then using a little bit of vacuum to hold that piece. It's obviously somewhat dense because it doesn't just come out with vacuum. I'm using a little bit of ultrasonic energy and then crushing it into smaller pieces. I take the chopper out, push BSS in, take the phaco tip out, and then go in with the INA handpiece. I'm starting to adjust the sleeve, making sure the sleeve is close to the tip. Start subincisionally, grasping the anterior cortical material. Once I grasp it with high vacuum, I tease it side to side, and I'm mechanically peeling it off the bag. And then I start to go around circumferentially, trying to grasp any cortical material that's stuck within the bag still. You can see that as I grabbed that one part, it grabbed the actual capsular bag and pulled the zonules. And so I quickly switched to the polish mode. Again, in denser lenses, I have always noticed that the bags tend to be a little bit more lax, the zonules tend to be a little bit more lax. And so I switched to polish mode fairly quickly so that I won't inadvertently grasp the capsular bag, which will also cause some stress on the zonules. So I'm polishing underneath the rhexis edge and now polishing the posterior capsule surface as well. And I'm injecting some BSS and pulsing the subincisional capsular fornix, making sure there's no lens material hiding there. Looks fairly clean. And then I'm going to inject some cohesive viscoelastic to fill the bag. And then using the capsule sweep to polish underneath the rhexis edge of any lens epithelial cells here. I polish on the left side and then the right side. I'm going to inject a single piece acrylic intraocular lens into the capsular bag, making sure the leading edge goes into the bag, the trailing edge is out of the bag. Go in with the INA off and then activate irrigation, making sure both haptics come off the optic. Go underneath the optic, tilting it and rotating it 90 degrees clockwise and removing all the viscoelastic from within the bag and underneath the lens. Reposit the lens back into the bag, and then I switch to polish mode because I saw some fine lens material between the lens and the bag, and then polishing underneath the rhexis edge here. I've actually switched to foot pedal control in progressing each of the steps rather than depending upon my technician to do these steps. And so it makes it a little bit easier to switch from Cortex to polish to visco mode. So I switched to visco mode, removing all the viscoelastic from the anterior chamber. I'm going to pulse the angle with the BSS cannula, make sure there's no hidden viscoelastic, and then I'll hydrate my incision. So again, this is a moderately dense lens, not terribly dense, but dense enough that I had to perform double chop, cross chop, mechanical fracturing, and some ultrasonic energy in order to disassemble this lens. You saw there's quite a bit of posterior capsule fibrosis, and you saw how I was able to systematically disassemble this lens using double chop, cross chop, and mechanical fracturing techniques. So I hope this was helpful to you, and I thank you for your attention.